In this presentation, I am going to talk about what is called transitional cell carcinoma of the urinary bladder. So what we have here is our urinary bladder, and you can see it has got an irregular outline, and what we have here is a thickening that we have here on the lower part of the urinary bladder. And what we have here, you can see that there is a lesion here, and you can see it's taking color here at its base, and you can see that the lesion actually have got angulations. It's very much irregular. It's an irregular lesion that you see here on the right side, here, the right lateral side of the urinary bladder. So the urothelial carcinoma is also known as the transitional cell carcinoma. It is by far the most common type of bladder cancer. In fact, if you have bladder cancer, it's almost certain to be a urothelial carcinoma that I am referring to as the transitional cell carcinoma. If in fact these cancers start in the urothelial cells that line the inside of the bladder. So you can see here, this is the lining of the urinary bladder, and you can see that the lesion is starting there, is starting here. This is the part of the urothelium of the urinary bladder. So this is a typical case of a transitional cell carcinoma. You can see that the lesion is actually starting here, and it's invading, it's stretching into the lumen of the urinary bladder, and part of the lining of the urinary bladder is spared, and it's actually significant that with time this is going to be invading the tissues around. So you can see there's hyperperfusion here at the base, meaning to say that this lesion is actually getting blood supply. You can see that. Again, you can appreciate the lesion, and you can appreciate the thickening that we have. What we have here is the rectum down there, and then you can actually appreciate that the urinary bladder is very much irregular. This is a 79-year-old male. You can appreciate what is taking place. However, the urine is actually clear, and it doesn't have internal echoes, as you can appreciate, as you can see here. So there is a thickening here, and this is looking more like debris, but it's not moving, or it wasn't moving with gravity to suggest that it was a mass. So it's more of a thickening of the urinary bladder. So there's a mass effect there. So coming here again, you can appreciate the lesion without color. So you can see the extension from here. There's a thickening here, so the lesion is coming all the way, and it's invading part of the lumen of the urinary bladder. So again, you can appreciate from this end, but at the base somewhere here, you can now start to appreciate some internal echoes here, and then you can actually see what is taking place. So this is characteristic of a urothelial carcinoma. This is characteristic of a urothelial carcinoma, and this patient was confirmed from the lab findings that he has transitional cell carcinoma of the urinary bladder. I thank you all for your time. I hope you're doing well wherever you are around the world. Once again, my name is Mr. L. Chitumba. I wish you well in your life. I wish you well in the journey of medical ultrasound. I wish you success. Thank you so much for your time. Do not forget to subscribe to this channel. Thank you.